My name is Dr. Nguyen. I'm one of the NeuroICU attendings here at Houston Methodist Hospital.
26.
GI prophylaxis and for the treatment of anaphylaxis.
A neurointensivist is one that specializes in neurologic diseases and also critical care medicine. So a neurointensivist takes care of the sickest neurologic patients. These include large strokes, also seizures, and a lot of neuromuscular diseases.
I've worked on a couple neuro-ICUs. I think the staff here has a good dynamic. It does feel like a family, as corny as it sounds, but people are excited to see each other and get along, which makes work a lot easier.
I've had the pleasure to work with Dr. Zwillman and all the other intensivists here. Don't tell the others, but he is our favorite. We just don't want them to know.
Dr. Zwillman's really fun to be around. I think just, passing him in the hallway, he always has little quirky comments to say, just to cheer you up throughout the day. So he's a really fun person to kind of work with in the hospital, especially when you're having kind of a sad day or a sad patient outcome. He'll always be one to cheer you up.
And yes, Dr. Zwillman is my favorite as well.
I think if you poll the rest of us, I think that's probably going to be our same answer.
It's okay. You're number 54. I know there are only 4 of us, but you're number 54 in my book.
My name is Elmo Hall Jr. The neurosurgeons come out and took that tumor, and he got me back to normal.
A pituitary adenoma is a tumor that when it grows, it can affect your vision. So for Mr. Elmo, this was resected with our neurosurgeon, Dr. Britz, and also with ENT as well. After these surgeries, what we monitor for is improvement in vision, which it seems like Mr. Elmo had, so that is very good news for him.
I like him, but he's a good guy. When he answered my question, he answered everything just like I asked. He's sincere about it. He wants it to be good. They couldn't ask for nothing no better.
The only way that a neuro-ICU works well is that you have good communication and interaction with the whole team. And the whole team isn't just physicians, nurse practitioners, residents, fellows, and we have some of the best nurses here at Houston Methodist.
When nurses are caring for the patients, it's just that incredible connection that you see between the patient and the nurse. As nurses, we get our bachelor's of science in nursing because we have to understand the science of everything, but then nursing really is just such an art, that involves the communications between the patients and family members.
Actually, let me give this to you on behalf of Jenny and me for our appreciation. I was in ICU for like 8 days. Y'all took great care. It's just a real small token. We've been meaning to give this to you for a long time, and for all the staff, it means a lot.
It's good to see you back. We cannot adequately express our appreciation. We wish you the greatest blessings on your lives.
Aw, that's so sweet.
I love when they come back. They make me so happy.
If not for them, things would not get done. Things would not be adherent to schedule. Families and patients would be without a ready shoulder to cry on. And when they say, we need you now, we get off our butts and we move because it's real.
I think neurointensivists have a very unique challenge. It's not a typical ICU like a cardiac ICU. The patients have a better time understanding if the heart isn't working well. If the brain isn't working well, there's a lot more gray area. It takes a lot of understanding, complexity, and communication skills that I think that neurointensivists, they hone those, and also understanding exactly what's needed for this very specific subtype of patient. Working on the ICU allows me to have a full understanding of how our patients are taken care of outside of the operating room. And it also allows me to practice all other forms of neurosurgery. If I wind up doing tumor or spine, patients are also taken care of on the ICU from time to time.
Part of our job here as the attendings, we of course take care of the patients, but we also need to teach as well. So the same trick that we did, as long as you're on top of the vessel, 90 degree turn with your probe, but you got to keep it in plane, like you don't lift it up. That's the tricky part. Yeah, you see that's where you're going, right? Look at you. And so you can kind of see real time you piercing that vessel. You see a lot of things that are very distressing, and it can get to you. at times as well. So I think it's very important to have colleagues that are seeing the same things, going through the same things, and able to share some of those moments. And I think it's been amazing to have this group.
The gravity of what we do here, sometimes you need that period of levity just to, get through your day. Because in a lot of ways, just our collaboration goes beyond just the medical aspect as well. It's really just been very supportive. And that's one thing that I'm very proud of this unit for, is that it's a very, very supportive unit, because even when we've had very, very challenging experiences, the ability to kind of talk and debrief beyond just the medical aspect, but really get to the personal level and make sure that everyone feels supported, including our nurses, in this very changing environment, is something that's very important.
The excellent thing about the NICU is the collegiality and friendship that we have with each other, and that we truly enjoy each other's company and augment each other's performance when we work together.
The NeuroICU at Methodist is a special place, and it's a special place because of the people that are here. I think the biggest compliment you can give a place is, if your loved one was sick, would you want him or her at that place? And I can definitively say that's a yes.